Grazie.
Thank you very much. It's an honor and a privilege to be here today, the first conference organized to talk about this disease. I met the organizers a few months ago, and it's been extremely surprising to discover that when you want to do something, when you really want to reach a goal, the families, parents in this case, and families as a whole have the will and the power to organize things and events like this. So thank you very much for inviting us. We are here with you. We want to support you. And I would like to give you a short presentation of how we can be present. I was given the topic of rare diseases at the national and international level. But before we do this, I would like to tell you who we are, because there are many families that come from so many different countries. I am Domenica Taruscio. I am the director of National Center for Rare Diseases that is within the National Institute of Health, and you see a picture of it right there. It's not too far away from here. What is this National Institute of Health? It's a very important body in our country, in Italy, and it's unique in its making because it is the technical and scientific body that must not be confused with the Ministry of Health, that of course it exists but does different things. So we are the technical scientific institution that helps the national health system. Our mission is to promote and protect public health at national and international level through research activity, monitoring activity, regulation, control, prevention, consulting, and training. So, more than 1,500 people work for our institute. Of course, we are divided into different departments, and one of these departments is dedicated to rare diseases. But we also do health technology assessment, we do research on global health, on chemical substances, and so on and so forth. The center I direct works exclusively on rare diseases. Our focus is rare diseases. We work at a national level, but we also operate in a global and European context, so an international context. And this is something that pleases me very much, because for many years we've been working also at an international level. We deal with primary prevention of rare diseases. Some people might wonder if it's possible to prevent them, and yes, the answer is yes, it is possible. And last night, I came back from Israel. I was there for an international conference on rare diseases, and I gave my contribution. I gave a presentation on primary and secondary prevention of rare diseases so that risk factors can be reduced, so that less diseases arise, and at the same time it's necessary to increase the protection. The very important factor is screening, prenatal screening. There is a new law in Italy that it's possible to identify disorders in over 40 rare diseases. Usually they belong to the field of metabolic diseases, but if they are identified right away when children are born, then they can be treated. So we also monitor the situation. As I said, we do quality control of genetic tests, and we provide information. We provide information to families, to citizens, to the civil society, to doctors, users through a hotline. You see the number right there on the screen. And we collaborate with a patients association, not only because we talk during the conferences, but we also have projects and activities together. And those activities are mainly scientific projects, but also empowerment projects of patients associations. We did a lot of courses of self-help or self-training. We have a strong training activity also at international level, as I was saying, on both how you build a register. We made important activities on guidelines, what it means to have guidelines for rare diseases, and we do research activities both in our center but also in collaboration with other institutions and structures. We do this, as I said, both at Italian level, European level, and global level. Again, I would like to stress the number of our hotline. This can be particularly important for families that have to deal with rare diseases. There are psychologists that can help you. It's telephone counseling. It's not a call center. It's counseling that we provide through this hotline. It means the people that will answer to the phone are psychologists, and they answer to the questions you might have. They ask questions in return. They might give indications and information that need to be updated, that need to be scientifically validated. But also, that information must be communicated in a certain way, must be disseminated in a certain way. In Italy, what do we have on rare diseases? We have a network that was created in 2001 and is made up of centers that are disseminated, that are scattered on the national territory. We have clinical centers that since 2001 have been doing prevention, monitoring, diagnosis, and treatment of rare diseases. These centers are mainly dedicated to diagnosis, but they should also do prevention activities. So inform the people and do monitoring through registers. And they actually do that thanks to regional registers. But it's also important that these centers deal with follow-up with patients. So we have a national register in the National Health Institute, and we manage that. And the patients that are inscribed in that register are more protected than other patients. For instance, they do not pay for their visits. So it's free of charge. The diagnosis is free of charge. It means that patients with a rare disease doesn't have to pay for anything. This is another slide that gives you more numbers about, more information about how we are present on the national territory. And we gather and collect patients' data at a national level. And I will be brief because I know that families are more interested in other concepts. But what we do is we collect data, and we have data about more than 600 rare diseases. This is extremely important for us because to carry out epidemiology studies is important. Epidemiology can inform other clinical studies, so it's important to have those data. So, in fact, as you can see, the National Register, that is our foundation for collecting data, can then produce information on how to organize our services, to see, for instance, if there is the need for new services. And also, based on this information, we decide how to do training courses, what direction the research must have, but also it's a point of contact for European networks. For those of you who knows these networks, those are very important structures that I want to spend a few words about. We also have a national plan, And to have a national plan on rare diseases is one of the objectives of the goals of the European Commission, as it was said in 2013. Almost every country in the European Union has a national plan. This was the first one that we had, and now together with the Ministry of Health, we're working on the second plan for a national plan for rare diseases. Because why is this important? Because all the initiatives that are meant for the protection of these patients are included in these general guidelines, which basically is what it means when we say a national plan. So it's very important to have one. At the European level, I was saying there are networks, that are reference networks. I'm sure that those who are here today who work in the scientific department know about this, but it's important also for the families to know what these European reference networks are. They are some virtual networks. There was a revolution in Europe since 2017 up to today. These are virtual networks organized according to groups of pathologies, of diseases, that put together the best hospitals all over Europe. And they are necessary to share scientific knowledge on a specific pathology or a group of pathologies. So this allows not to be isolated on a specific disease in a country or 2 or 3 countries, but to communicate on the whole European territory simultaneously and to share data and experiences. So it's important for doctors, it's important for families. They can all share their information, their data, their experiences. And if you're looking for an answer, you might find one in those networks. And in a few years, this will be an even greater revolution when it comes to approach to rare diseases. I mentioned the year 2017, and I said that because there was the opening of this European network. Each one of these network as a coordinator. This is historical photography. In March 2017, with a great and important ceremony, the 24 European reference networks were established. And the motto is share, care, and cure. And as you can see, there is a list of the topics that each one of these networks deals with. We're talking about 8,000 rare diseases. They were grouped into 24 macro areas. For instance, all the pathologies that have to do with bones. It belongs to the network that is called BOND, for instance. There are pathologies that are that cover more than one group. And I was at the European Commission to talk about these networks, and we talked about how to optimize the 24 networks for those diseases that do not belong to any of these groups. Not only that, but there are diseases that belong to more than one network. They are cross-cutting, as I was saying. So it's important to know how to use those networks. Here is another slide that gives you more details about these European reference networks, but you can take a look at the European Commission website or the Italian website of the Ministry of Health, where there are many more details, or you can talk to me. Here are the coordinators. The 3 of them are Italian. You can see up there Maurizio Scarpa, Dr. Mosca, and Dr. San Giorgi, that are the 3 Italian coordinators. The rest of them come from other European countries, but Italy participates in 23 European reference network. There will be another call, so we will be in the 24th network too. I would like to urge Italian people to go and take a look at the website of the Ministry of Health. The deadline for the second call is November 30th of this year, in a couple of weeks. And we hope we can enrich the Italian network And also, let's spend a few words about the international network. There is a consortium that is called the IRDIRC, that is made up of patients associations, institutions, companies, researchers. Of course, there are rules to have access to it. It means that institutions need to declare to have at least 10 million euros of funds allocated for a period of at least 5 years for rare diseases. But this is a global structure that allows us to operate at a global level. At the European level, a few months ago, a new project started. A very important action was launched, the European Joint Program on Rare Diseases. That's the name of the project. 110 million euros were allocated for this project. Half of the funds were provided by the European Commission, the other half by the Association of Patients. Here we are in the context of a very specific association, but I wanted to mention another association that is called an umbrella association, UNAMO, maybe you know it, and it's important to know what other channels that we might use. UNAMO is one of those resources. At a European level, there is Eurordis. It's a European association that you might know already that is very active in terms of Health World Organization and at a global level. And it's the one that generated the Rare Disease Day, that is the day where we celebrate rare diseases. And to wrap up, I would like to say that as a National Health Institute, we have many activities, but we also have created a competition, an artistic literary competition. We have arrived at the 12th edition. The name is The Flight of Pegasus, Il Volo di Pegaso. It is an occasion, a space where anybody can present a picture, a work of art, a book, whatever people want, to have the possibility to participate in this expressive space, to have the possibility to express oneself and give a contribution to make rare diseases more known to the public. On the 6th of January 2020 is the deadline for presenting your works. It's open to everybody. If you go to our website, you will find the rules and requisites, and it will be a joy to celebrate together during the week dedicated to rare diseases, which is the last week of the month of February, as you might know already. Every year we choose a topic. This year's topic is Beauty Unites People. That should be the inspiration for a poem, a literary work, a picture, whatever you like. And the winners will be awarded on that day. These are some pictures from the ceremony that we had last year. Art is extremely important for a patient. Thank you very much for your attention. Unite art and science is extremely important. Thank you.